Hello, my name is Courtney Magic, and this presentation covers roadblocks in healthcare code sets, classifications, or clinical terminologies. The roadblock being presented today is the use of unlisted HCPCS and CPT codes. Unlisted procedure codes are used when there is no other HCPCS or CPT code existing that reflects the procedure or service the provider wants to submit for reimbursement. These codes are commonly used when providers are performing new procedures or using new technology. The CPT books list unlisted codes at the end of each section or subsection, and also in the guidelines section of each chapter. Unlisted codes are used for tracking and reporting these services until a more specific or formal code is established. The specific roadblocks that are associated with the use of unlisted CPT HCPCS procedure codes are listed here. The first one is, these codes do not capture the full extent of the procedure performed. The next one, the unlisted procedure codes do not capture the full revenue for the hospital or facility, and they do not capture RVUs for the physician. The third roadblock listed here, submitting an unlisted procedure code includes more administrative duties and time, and that's something that we'll get into on the later slides. And last, unlisted procedure codes are often denied by the payers that they're submitted to. On this slide, we will discuss how the process of using unlisted codes can be improved. First are better pre-authorization practices. On top of the normal pre-authorization process, a written authorization should be obtained before the procedure is performed. This written authorization should also be submitted with the claim. Next is better workflows for submitting claims with unlisted codes. The first part of this workflow should be setting your fee for the unlisted procedure. To set your fee, choose a comparison code that is similar to the unlisted procedure being performed. Make sure this code is selected from the same body area. Next, you'll need to list 2 or 3 factors that make the unlisted procedure more or less difficult than the comparison code. These factors could include a different approach, the time it takes to complete the procedure, or maybe a different method of closure. Next, you'll need to indicate the difference in work between the unlisted procedure code and the comparison code using a percentage. For example, you might estimate that the unlisted procedure required 50% more time for exposure, exploration, and the closure than the comparison CPT code. If your comparison CPT code fee is $1,000, you would set your fee for the unlisted procedure at $1,500 because it required 50% more time to perform the procedure. All of this information should be submitted with the claim on a cover letter. The claim should also include a detailed description of the procedure, and other items to submit include the certificate of medical necessity and the discharge summary. Last part of the submitting claims section is to know your payer's specific process. Certain payers have certain guidelines that might be different from others, so it's important to understand what those payers require and what you will need to submit with the unlisted procedure. Next is to monitor the claim as it goes through the submission process. Keep an eye on the claim. Once you receive the EOB, take a thorough look at that, and if the claim is denied, follow up with the payer to see if the denial can be resolved. Last is to share the information, particularly if you have an unlisted procedure that might be performed on a high volume of patients in the Medicare population. All of the information that is obtained for your cover letter should also be shared with the surgical representative on the Medicare Contractor Advisory Committee. This representative will inform the Medicare contractor medical director of the new procedure so that future cases can be reviewed and processed more efficiently. Next, we will discuss some of the areas that we can focus on to get through some of these roadblocks. As mentioned before, for a Medicare population, the information should be shared. Some of the information that can be shared includes peer research, data from physicians performing the procedure currently, and data from facilities where the procedure is being performed. Also, success stories. This will help support the need for a specific formal code to be created for the procedure. This slide highlights a few of the recommendations to resolve current and future roadblocks associated with using unlisted codes. First is to consistently follow the workflow in place for claim submission of the unlisted codes. This goes back to the information that was discussed on slide number 4. Consistently following that workflow and learning from the workflow as you use it and submit claims will hopefully produce consistent outcomes, which will get the unlisted code paid successfully. Next is to stay current on the requests for the new code process. Make sure that you have all of your documentation needed and that you're putting your request in for a new code in a timely process. Next is to stay up to date with research and industry news on the topic. Knowing all of the latest facts and information about the procedure will help to support the need for a new code. In summary, reporting unlisted codes can be time-consuming and complicated for staff and physicians due to the supporting documentation that is required to be submitted with the claim. Being familiar with payer-specific guidelines and the processes in place to submit these codes can reduce some of the time needed to submit the claims and also reduce some of the frustration that goes along with submitting these claims. Once you're familiar with the payer-specific guidelines and the process, make sure to follow a consistent workflow and learn from that workflow as you use it. Also, networking and staying on top of the request process and industry news and new research is crucial to using these unlisted codes. The more research, the more details that everybody knows about the procedure will support the need for a formal code, along with the formal request process that's followed when requesting a new code.